Hello, my name is Samantha. I'd like to thank our host for organizing this conference. Today I will be speaking to you about the importance of skin preparation in electroconvulsive therapy. Electroconvulsive therapy, or ECT, has long been a treatment for mental health disorders. The safety and efficacy of ECT has much improved over the last century, making it an effective treatment for depressive disorders when pharmacological therapies have failed. Most patients undergoing ECT treatment see relief in their depression, typically after several ECT sessions and sometimes with the addition of medication. ECT works by applying electrical pulses to the scalp via electrodes that carry current to the brain. The goal is for the current to induce a seizure in the brain, thus charge is increased during treatment until a seizure threshold is reached. The brain's adaptation to the seizure is responsible for ECT's antidepressant effects. Although it is not fully understood how ECT improves depression, it is thought to promote the activation of dopamine-responsive neurons. During the administration of ECT, current density is much greater in the area surrounding the electrodes than in the rest of the brain. This is because current is entering the body via the electrodes. During the setup of ECT, the impedance of the electrode is measured with currents much smaller than those of treatment. Impedance prior to treatment is called static impedance. Both the contact area and the quality of the skin-electrode interface influence static impedance, and as such, they are important in the setup of treatment. In the present study, we vary the conditions under which ECT adhesive electrodes were prepared for ECT. During the administration of ECT, there are many different ways to prepare the skin for electrode placement. Particular factors of importance include the contact area between the skin and the electrode, the adhesion between the skin and the electrode, and the cleaning solution for skin. Preparations vary in conductive gels used and types of cleaning solutions. We were interested in how these conditions impact static impedance. After varying electrode preparation under 6 conditions, we measured the static impedance across electrodes every minute until static impedance stabilized. The impedance under 6 conditions was measured for 3 healthy subjects. With many different combinations of prep, we selected 6 that would best reveal the role of each method. There were at least 3 trials for each condition on each subject, accounted for by the error bars in these graphs. 2 commercial ECT machines were used to measure static impedance, the Thymatron and the Mecto. Focusing in on one exemplary subject, we can see that all conditions with an adhesive substance had comparable impedances. We also see that decreasing surface area increases static impedance. The concentration of ions had no significant effect on impedance. These results point to the idea that variations in static impedance are largely driven by the quantity from electrode coverage and quality from surface adhesion of the skin-electrode interface. Not always when we believe there is full coverage is there full contact. Optimizing the preparation of the skin will enable the current calculated to best induce a seizure for each patient to reach the brain. Thank you for listening to my talk.